So, if you get your health insurance through the ACA, you might have had a bit of a shock when you opened your latest bill. Chances are it went up, maybe a lot. So, what in the world is going on? Let's break down why healthcare just got so much more expensive for millions and millions of people. Just look at this number for a second. 1.4 million. That's how many fewer people have signed up for an ACA plan this year compared to last. That is a huge drop, and it's a massive signal that something is seriously wrong. All right, to really get our heads around this, here's our roadmap for this explainer. We're going to start with that big drop in enrollment. Then we'll dig into the why, this thing called expiring subsidies. We'll see how politics played a huge role, what all this means for your wallet, and finally, where we go from here. Okay, so first things first, let's really get a handle on just how big this drop in enrollment actually is. You can see it right here, plain as day. The federal data shows that plan selections fell from 24.2 million people last year all the way down to 22.8 million this year. I mean, that's a ton of people who might be walking around right now without any health coverage. So what happened? What's pushing them out of the market? And that brings us right to the heart of the matter, the main reason for this whole situation. A really big change in the financial help that millions of American families were depending on. It's all about something called premium tax credits. The easiest way to think about them is like a discount coupon from the government that you use for your monthly insurance bill. And look, for a ton of folks, these credits are the only thing that makes having health insurance even remotely possible. So here's the quick backstory. These subsidies have always been a part of the ACA, but during the pandemic, they got a major boost. They were enhanced, which is just a fancy way of saying they helped more people and gave them more money. But here's the catch, and it's a big one. That extra help was never meant to be permanent. It had an expiration date, December 2025, and when that date hit, poof, the extra help was gone. Now, that expiration date wasn't exactly a surprise. Everyone knew it was coming. So why didn't anyone do something to stop it? Well, the answer, as it so often is politics. It all happened in Washington. So what it really boiled down to was a classic political standoff. As lawmakers were trying to pass a bill to keep the government open, Democrats insisted that extending these tax credits had to be part of the deal. On the other side, Republicans argued that the pandemic-era help went too far, and they wanted to tackle the subsidy issues separately at another time. And the outcome? Well, they did reach a deal to fund the government and avoid a shutdown. But that deal did not include an extension for the enhanced subsidies. They were just left to expire. And that one decision is having these massive real-world consequences that we're seeing right now. Which brings us to the sticker shock. Because without that extra help, premiums are absolutely skyrocketing for millions of people all across the country. I mean, just to put a number on it, take a look at Texas. Some folks there are seeing their premiums jump by 35%, sometimes even more. Seriously, just imagine your health insurance bill suddenly costing a third more than it did just last month. But believe it or not, it gets even more dramatic than that. A huge nationwide analysis by KFF, that's a major health policy research group, found that, on average, people getting financial help would see their premiums more than double. That's an increase of 114%. And let's turn that percentage into cold, hard cash, because that's what really matters, right? That same analysis shows the average premium leaping from about $888 a month with the subsidy to over $1,900 a month without it. That's an extra $1,000 a month for the exact same plan. And you know, this isn't just numbers on a chart, it's crushing real people. A health agent down in Houston, Gerardo Ramirez, told a story about one family he was helping. For a family of 4, they were paying around $600 a month. The next year, without that extra help, that same premium jumped to $1,000. So that leads us to our final and maybe most important question: what happens now? Because when you're faced with a price hike that huge, you're forced to make some unbelievably tough choices. For families caught in this mess, it really comes down to 3 options. 1, you somehow, some way find the extra money to pay for it every single month. 2, you downgrade to a cheaper plan, which almost always means you'll have a sky-high deductible if you actually need to use it. Or 3, you just drop your insurance altogether and pray you don't get sick. Yeah, not exactly great choices, are they? And this problem doesn't just stop with the families who lost their subsidies. It creates a ripple effect across the entire system. See, by law, hospitals have to treat people in an emergency, whether they're insured or not. So when more and more uninsured people can't pay those massive hospital bills, that cost has to go somewhere. It gets absorbed by the system, and that often means higher prices for literally everyone else. So at the end of the day, we're left with this. When that financial help goes away, it's the families who pay the immediate, painful price. But as we've seen, those costs don't just disappear. They ripple outwards. It really forces you to ask, when a subsidy like this expires, who really ends up paying the price for healthcare?